Thank you, Dr. K.K. Agarwal, for those kind words. We have been looking at the robotic model, the Da Vinci, for so many applications. Well, ophthalmology is not far behind, and we have another robotic presentation in cataract surgery. Okay. So this is the bladeless robotic Femto Second laser cataract surgery, also now named as the future of cataract surgery. It is said that every once in a while, a revolutionary technology comes that changes everything. In cataract, one stage was when ECC came with IOL. At that time, it created a revolution in cataract surgery, because cataract surgery at that time was not just about removing the cataract as an ICCE, but it was about putting an IOL in the eye and restoring the vision to near normal. So that was a revolution when the IOL came in. 2 decades before, the phaco came in. And phaco changed the whole cataract experience. The surgery became stitchless, small incision, safer, less astigmatism, faster recovery. Now, unquestionably, every cataract surgery, everybody wants to get it done by a phaco technique. However, phaco is not all that simple. So it is compared to be a domain of a skilled surgeon. It involves a long learning curve. A resident has to go through almost 3 to 4 years of training before he can say that he is a phaco surgeon. It requires high degree of skills. Not everybody makes it to that top category. You need very steady hands, that most of the surgeons do, and you have to be ambidextrous. You need both your hands functioning equally well, and both your feet also, because you're handling the microscope and the phaco machine with your feet while you do your surgery with both your hands. So the next step would be, can a technology help most surgeons to become skilled surgeons? The answer would be yes, if only we could have a machine that could reduce the learning curve, do the difficult steps of surgery, and improves upon the skills of a skilled surgeon. So today, once again, cataract surgery is going to change forever. As the machine we are talking about is here, and this machine is the LensX Femto Second laser, also dubbed as the robotic surgery. So I'll show you a small video. This is a very new machine as yet. We have done 40 surgeries. Where's the video gone? Okay, so this is a machine, and this is the way the machine docks onto the eye, and live images of the eye come onto the computer screen through a system which is called an OCT system. So the OCT is picking up the images live onto the screen, and then this is the machine docking on the eye. And then we mark the position on the screen, and now you'll see the images coming onto this side of the eye. So now the machine is scanning, and this is showing the images of the eye. Here is this entire surface of the lens, and we are adjusting the laser in such a way that it will cut the anterior capsule and make a round CCC. We accept this data. We move on to the next step, that is the lens. This is the lens which has become cataractus, and now we are adjusting the machine so that we are going to cut the lens into pieces, as many pieces as we want to. Then we come to the incisions. We are marking the incisions, how we want the incisions on the eye. All this is going to be done by the laser, and then we press accept. And now the laser is moving. We have still not entered the eye. We have still not entered the eye. The laser is moving, and it has made this CCC, that is the capsulorhexis. It has made the capsulorhexis on the eye, and now it is cutting. Now it is cutting the lens to break it up into pieces. And now we have about 4 pieces coming up, and here we are making the incision. This is the main incision on the eye. Which is about 2.2 millimeters, and this is the side port incision, the side incision. So all this work has been done by the laser. And now the next step, we take the patient to the operation theater and finish off the surgery. So we are just opening up the incisions made by the laser with a blunt instrument. The laser is making all the instruments, no blades used. And then this opening in the anterior capsule called capsulorhexis, you can see that this capsulorhexis is perfectly round, almost as if it has been made by a compass. And it happens like this in 100% of the cases, which cannot be mimicked or done by human hands. It is so precise. So this capsule has already been cut, so you just have to pull away at the capsule and bring out this piece. So we just disengage the entire capsule, bring this piece out. And you can see this crochet incision. That means the lens has already been divided into 4 pieces. So with an instrument, we just separate the pieces into complete 4 segments. And then with minimal phaco energy, because we have done already so much of cutting in the eye with the femto laser, so phaco energy requirements are minimum. They are reduced to 1/3 the amount of a normal phaco. We just remove the cataract. If the cataract is soft, we can just remove it like that with 0 phaco energy. That means just aspirating it out. If the cataract is more dense, we need minimal phaco energy to remove it. There's a little bit of cortical matter which has to be sucked out in a routine way. And then an intraocular lens of your choice is implanted in the eye. So this is where you can choose a monofocal lens, you can choose a multifocal lens. The choice is yours. There's a whole variety of lenses out there. So these are the points which need to be highlighted in this surgery. Number 1, the laser makes an ideal capsulotomy, this opening in the anterior capsule, which is round, almost compass-like, which cannot be made by human hands. Exactly 5 millimeters to size, which cannot be done by human hands. It has to be central all the time and 100% reproducible. So this is what has been made by the femto laser. This is the capsulotomy which is made by a human hand. You can see the difference. This is just compass-like capsulotomy. The advantage is, if you have a perfect capsulotomy, it determines the effective lens position of the IOL in the eye, at what level will the IOL lie in the eye, and this will determine the actual power of the IOL in the eye and the visual outcome, which is the final visual outcome. So if we are targeting on perfect visual outcomes, we need perfect surgery. The next thing the femto laser does is lens fragmentation. That is breaking up the lens into multiple pieces. Phaco, we know, is not a laser, even though many people popularize it as the laser technique. It is an ultrasonic energy which is used to dissolve the lens. And if we use excessive phaco energy, it can damage the endothelium of the cornea. And if the endothelium gets damaged, the cornea gets decompensated and you have a corneal edema, which can be residual bullous keratopathy, which can result in a loss of vision. This is more so when we are handling hard cataracts or in beginner's hand. Laser does not do anything like this. So in conditions of soft cataracts, we break up the lens into multiple pieces. They can just be sucked out, zero phaco energy. And if it is a hard cataract, the lens is pre-chopped into small pieces like I showed you. So the laser energy, the phaco energy required is 1/3 of the normal phaco energy. The endothelium is safe. Net result, first day post-op, you have crystal clear cornea. A small animation of this technology. This is the lens fragmentation which is happening in the eye with the laser. It is causing cylindrical cutting so that it is breaking up the lens into multiple pieces. So you have concentric cuts in the nucleus of the lens. This is where we are making the incision, and we just pick up the anterior capsule and pull it out. The lens, which has already been dissolved into multiple pieces, can just be sucked out with a cannula. If the lens is hard, we make incisions in the nucleus like a cruciate incision, breaking up the lens into 4 parts. This is what I showed you. You're making the primary incisions and the secondary incisions with the laser. We do a capsulotomy, remove the anterior capsule, and then with minimal phaco energy, because the lens has already been chopped up, we remove the cataract. This technology is also now being referred to as the bladeless cataract surgery. Why bladeless? Because here the cutting tool is the laser. It's not that we are not making the incisions. The cutting tool is the laser. That's why it is bladeless. It is not using a regular blade, which is manually controlled. Here the laser cutting tool is computer controlled, so therefore its accuracy and precision is far better than what you can do with a human hand and a normal blade. Popularly called the robotic cataract surgery, because it's a computer controlled laser assisted surgery. And the critical steps of surgery, which are the difficult steps, are automated. This technology gives a vision which is better than a conventional phaco, because phaco corrects only the pre-existing sphere. Because once you place an IOL in the IOL will correct the spherical power of the patient's eye. Femto laser will correct the sphere with an IOL, and it will correct the pre-existing cylinder in the eye, because it has a technology which is called an astigmatic control module, an LRI incision. With an LRI incision placed like this with the laser, we can reshape the cornea and make it more spherical and remove the cylinder power in the eye. And 80% of the patients who have cylinders can be corrected by this technique. So it improves the visual outcome than what can be done with a regular phaco. It is considered safer than conventional phaco because it is improving the surgeon's performance. It is reducing human error. And the incisions which we are making are more precise, secure and leak-proof, so there are less risks of infection. 55 seconds is the time it takes to do the Femto Second part of the cataract surgery. After docking and you press the button, the whole procedure is done in 55 seconds, which includes capsulotomy, lens fragmentation, and incisions. The laser is US FDA approved. It has completed its clinical trials. It's got its US FDA approval. It has also got its CE mark. And now there are 4 such units in the country. However, this laser is not for everybody. There are always limitations to our technology. This laser cannot be used in patients who have a poorly dilating pupil, because we are using this laser on the eye without actually entering the eye. So if your pupil does not dilate, you will not get the space to cut in the anterior capsule. It cannot be done in patients who have advanced glaucoma, because you have to dock the laser onto the eye, and there's a suction machine which is holding the docking system to the eye, that is building up the pressure of the eye. So if the patient is suffering from advanced glaucoma, this laser is not for this person.
Can we sum up?
And it is as yet not cleared for use in children as yet. And this is my last slide. The cost. It's a very expensive equipment, costs over 4 crores. It requires 24/7 air conditioning, room temperature 21, humidity 40 degrees. It has to be fixed, 40%. Therefore, the cost of the surgery is a little more than a regular conventional phaco. Thank you, because we are in the era of lasers of the future.
Thank you.